This multivitamin product is used to prevent or treat vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help maintain good health. Honey Bear's Multivitamin Chewable Tablet Multivitamins provide a combination of vitamins to support overall health. It is recommended to take one tablet daily, preferably with a meal, or as directed by a healthcare professional. Taking the multivitamin at the same time each day can help you remember to take it consistently. Make sure to chew the Honey Bear's Multivitamin Chewable Tablet thoroughly and swallow it once a day, or as directed by your doctor. It's important to follow the directions on the product package and not exceed the recommended dosage. If you have any questions, be sure to ask your doctor or pharmacist. Taking this medication regularly will help you get the most benefit from it. To help you remember, try taking it at the same time each day. Some common side effects of Honey Bear's Multivitamin Chewable Tablet Multivitamins include constipation, diarrhea, or upset stomach. These effects are usually temporary and may disappear as your body adjusts to the medication. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada. It's important to keep multivitamins with iron out of reach of children, as accidental overdose can be fatal. If overdose occurs, seek medical help or call a poison control center immediately. Before taking Honey Bear's Multivitamin Chewable Tablet Multivitamins, it's important to discuss any allergies you may have with your doctor or pharmacist. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to talk to your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have a history of alcohol use/abuse, liver problems, or stomach/intestinal issues such as ulcers or colitis. If your multivitamin contains folic acid, be sure to let your doctor or pharmacist know if you have a vitamin B12 deficiency, pernicious anemia, before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, which can lead to serious nerve problems. Consult your doctor or pharmacist for more information. Additionally, if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, or phenylalanine, it's important to consult your doctor or pharmacist about using this drug safely, as it may contain aspartame. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication, as it may pass into breast milk. It's important to be aware of potential drug interactions when taking multivitamins. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. It's important to talk to your doctor or pharmacist about the best timing for taking your multivitamin if it contains iron. Additionally, if your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. It's also important to note that this medication may interfere with certain lab tests, so be sure to inform lab personnel and your doctors that you are taking this medication. If you or someone you know has taken too many Honey Bear's Multivitamin Chewable Tablet Multivitamins and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can dial 911 or call your local poison control center at 1-800-222-1222. Canadian residents should contact their provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It's crucial to seek immediate medical attention if you suspect an overdose. Remember to keep all your medical and lab appointments. It's important to note that these chewable multivitamins are not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you forget to take a dose of this multivitamin on your prescribed schedule, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's best to take this multivitamin at the same time every day for optimal results. When using Honey Bear's Multivitamin Chewable Tablet multivitamins, it's important to store them at room temperature, away from light and moisture. Avoid storing them in the bathroom, and always keep medications out of reach of children and pets. When it comes to discarding the product, do not flush the tablets down the toilet or pour them into a drain unless specifically instructed to do so. Instead, properly dispose of the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.